One of the most important things that I find that's key and vital is good sleep hygiene. Good sleep hygiene is a consistent time to bed and time awake with as few naps as possible. Reduction in stimulants like caffeine or nicotine at least 4 to 5 hours before bed is recommended. And this is all without a sleep disorder. So I would say consistency is probably one of the most vital things that we should practice. That's difficult in our world today, though. And as I find that people have increase in stress, sleep is one of the first things that is sacrificed. But what I notice most of the time is when I'm getting a sleep history, I'll ask, what is your time to bed? And they'll say, well, since this pandemic, they'll either go to bed earlier or later. And so everything seems to be off kilter since the pandemic. Good sleep is important because it affects how we learn in terms of college age and school age children, but also how we work. There are millions of dollars spent on poor work performance. It can also affect how we drive, and there are some people that have automobile accidents secondary to just poor sleep, as well as having a sleep disorder. So in terms of how it affects our work quality, a good night's rest is recommended. The American Academy of Sleep Medicine recommends between 7 and 9 hours of sleep. Patients that get fewer than 7 hours of sleep are at risk for things like obesity, diabetes, high blood pressure, can compromise the immune system, and there are other behavioral health matters that can also occur, such as depression or anxiety, as a result of getting fewer than 7 hours of sleep. Increase in stress can actually cause things like nightmares or, in some cases, sleepwalking. So an increase in stress can induce many things, whether it's sleep disorder or even disturb our sleep. As the sleep quality deteriorates, behavioral health matters can set in, such as anxiety or depression, and sometimes we have to call on our colleagues in behavioral health to help us out from time to time.